1 in 3 of America's children is overweight or obese. I'm Jill Horner. This is Comcast Newsmakers. With me is Andrea Plaza, Vice President of the Community YMCA. Thanks so much for being with us.
Thanks for having me.
When we hear statistics like that, what does that mean on a national level in terms of kids being healthy and in terms of health care? And how is the YMCA working to address this national health care crisis?
Well, the YMCA just made a very important commitment and an announcement to First Lady Michelle Obama, who leads the Let's Move initiative, and to the Partnership for a Healthy America that we are going to establish healthy living standards, eating standards, and physical activity standards for children in all of our preschool programs as well as in our after-school programs. And the idea really is to keep kids active.
And now when we talk about kids being overweight or obese and some of the challenges that can present not only at a young age but as children grow and develop, what can that mean for them long term, and how can these initiatives actually benefit them not only now but for the future?
Well, the statistics are really staggering. In the last 30 years, there's been a 30% increase in the number of children who are obese. So 1 in 3 children is either overweight or obese. And the numbers are even more devastating and higher in the Latino and African American communities, where 40% of children are obese or overweight. Here in New Jersey, we have the highest rate of obesity among children 2 to 5. So it has a devastating impact on children's health. Our kids are at risk. This generation of children is the first that will have a shorter lifespan than their parents. So they are at risk of developing chronic disease like type 2 diabetes, cholesterol, high blood pressure, and other chronic disease.
You're actually looking to increase some of the standards as it relates to physical activity and nutrition. Give us some of the highlights when it comes to that.
Well, the standards are really aimed at making a healthy choice an easy choice for children and families. So the standards call for a minimum amount of physical activity for children to participate in when they're in a YMCA preschool or after-school program. It designates fruit and vegetables as snack options, water as the primary beverage during snack time, and limiting the amount of time that children are in front of a screen. The average kid spends about 8 hours a day in front of a screen. And another important part of the standards is the fact that there'll be support for families so that they can learn to adopt healthier habits and lifestyles at home.
Let's talk a little bit about access, because that can be critical for families, because when we talk about healthier options and access to safe recreation options, these can also be expensive for families. Talk about what the YMCA is doing to increase access.
Sure. Well, first of all, we're expanding our programs throughout Monmouth County, and we have a lot of partnerships in the schools. We reach over 10,000 children annually throughout Monmouth County, and with partnerships in schools, we serve about 2,000 children every day in our after-school programs and in preschool. We have a very strong commitment to children in Red Bank. They receive a free Healthy Kids membership. Children in grades kindergarten through 8 can enjoy a free membership at the Y, and their families can also benefit through Friday gym time and Saturday swim time, so that the whole family can enjoy time together in a healthy environment. We're expanding programs in Southern Monmouth County through a partnership with Good Sports USA. We are introducing a after-school program there at that facility, as well as activities for kids and for families. In Eastern Middletown, through a partnership with the Hillside Community Center, we are rolling out a new preschool program in January, as well as activities for kids and for adults in that community. Some of the other things that we're doing throughout the county is really helping families understand more about how to live healthier lifestyles.
All right, come back, give us an update. Let us know how these programs are progressing.
Thank you.
Thanks for being with us. We've been talking with Andrea Plaza. I'm Jill Horner.